Welcome. I'm Denise Luck, and I'm your U.S. Family Health Plan Health Benefits Specialist from Martins Point Healthcare. And today, I will be providing your briefing on TRICARE and your benefits. It is important to know where you are on the eligibility cycle. I know that many of you have started pre-activation orders back in July and August, and hopefully you've gotten yourself and your families enrolled into the plan that you want them to use. Activation will be coming up soon. Post-activation will be 180 days of continued free TRICARE coverage. It is not automatic. You do have to sign up, and we'll go over that more in detail at post-deployment and at the end of this brief. After the TAMP has ended, the 180 days, you will then be enrolling back into either your TRICARE Reserve Select or your commercial work coverage, whichever of those you may have. The most important thing that you can do for yourself and your family is to be sure that you're accurately enrolled in the DEERS system. So what is DEERS? DEERS is the Defense Enrollment Eligibility Reporting System. So essentially, they're the train driving all your benefits. If you're not listed in DEERS correctly, orders aren't listed in DEERS correctly, you will not be able to get benefits. So be sure that everybody in your family and yourself are reflected correctly. With TRICARE eligibility, you have options of two different plans. TRICARE Select is only administered by Humana Military. With this plan, care is not free. You do have deductibles to meet as well as cost shares or co-pays depending on the type of provider that you see. The other option, TRICARE Prime, is free care for our active duty family members. And you have two options to get the TRICARE Prime: Martins Point U.S. Family Health Plan and Humana Military. This is a great slide that goes over TRICARE and the many different plans that are associated with it. Just saying you have TRICARE doesn't give the whole story. It is important to know whether or not you have TRICARE Prime or TRICARE Select. And as you can see, there are many ways to get TRICARE Prime: Martins Point U.S. Family Health Plan, and then the managed care contractor Humana, as well as military treatment facilities if you happen to live nearby. Okay, now you have TRICARE, and so let's talk about access to some various services. Let's start with prescription access. If you're enrolled to Humana Military, you have the option to use home delivery or network pharmacies. Keep in mind that there are certain prescriptions that are required to be filled through the home delivery system at Express Scripts. You'll want to give them a call to find out if your prescription is on that list. Keep in mind that network pharmacies do not include CVS. They don't currently have a contract with Humana Military, and if you use non-network pharmacies, you will pay the full price of the medication. For those of you that enrolled to the Martins Point U.S. Family Health Plan, we also have a requirement for use of the mail order pharmacy when you are on maintenance prescriptions. Maintenance prescriptions are those medications that you take on a daily basis. They could be things like blood pressure medicine or cholesterol medications. You also have access to our local pharmacies in the communities for urgent one-time fills, such as an antibiotic or possibly some breathing medication or something like that. We don't want to delay your care for those types of urgent situations. You also have access to the local pharmacies for the first 30 days of a brand new medication as well. We have a large network of retail pharmacies, and we do not have any current pharmacy branches that are excluded from the network. Okay, let's move on to TRICARE Dental. As the active duty service member, you're automatically enrolled when you are activated into the TRICARE Active Duty Dental Program. It is administered by United Concordia. And if you need to get care locally, you need to make sure you find a participating provider with United Concordia. And you also have to call them to get an appointment control number to authorize the care. Otherwise, it won't be paid. So very important to make sure you get those control numbers prior to getting any care. TRICARE Dental for the dependents is a separate enrollment, separate cost. It is not automatic and it's not part of the medical. If you want dental coverage for your family, you do have to take the action to get them enrolled. There is a phone number and a website on the slide, and you can do either way to get your family members enrolled. You'll want to make sure that the dentist you'll be using does participate with United Concordia to make sure you're going to get the full benefit. Cost-wise, you'll be using the active duty cost during the deployment, so you can see the rates are very reasonable. Okay, let's take a look at the vision options. I know this slide references retirees, but it also references active duty family members. And so we're going to talk about your benefits through FedVIP. If you are enrolled into a TRICARE Prime plan, Select Plan, TRS, TRR, you have the ability to purchase vision coverage through FedVIP. You have to enroll within 60 days of the qualifying life event, which would have been pre-activation orders or activation orders. You can enroll online or via telephone at the number in the website that they've listed here. So this is a separate enrollment, separate cost, purchasing vision care for your family during your deployment phase. For those of you that did enroll to the Martins Point U.S. Family Health Plan, you do get an annual routine eye exam with a network provider. It is not a separate enrollment or separate cost. It is just part of your benefit as being a member of the Martins Point Healthcare Plan. We also offer 35% discounts on eyeglasses or eyewear with our partnership with iMed as part of our value-added services. We also offer other discounts on complementary and alternative medicine and health supplements and health and fitness information. Let's talk about referrals and authorizations. For those of you that enrolled into a TRICARE Prime plan, you do require a referral to be seen by a specialty provider. For those of you enrolled to the Martins Point U.S. Family Health Plan, if the specialty provider that you need to see is in our network, you do not need a written referral from us, Martins Point, the insurance company. It is a doctor-to-doctor professional communication. That is if the specialty provider you need to see is in network. For those enrolled to Humana Military, if you need to see a specialist, you are required to get a written referral. Your primary care doctor does have to submit a request to Humana Military. They process it, and then they send back a letter to you and your provider with the approval or denial of care with that specialty provider and a set of visits that you can utilize. So it's very important to understand what you need to do depending on your plan to see a specialty provider. If you see a specialist without a referral from either plan, you could end up with increased out-of-pocket cost. Authorizations are a slightly different option. They are for services that may require some medical review. They may apply to certain services. It is important that if you are having any kind of outpatient procedures, inpatient procedures, that type of thing, your providers will be checking with your insurance to see if authorizations are required. All TRICARE Prime programs offer what they call the point of service or out-of-network benefit. This allows you to see non-network providers if you so choose, even though there are network providers in your area. It allows you to see anybody you want, but you will pay more out of pocket. Initial deductible is $300 individual, $600 family, and then you're responsible for 50% of the cost. So this is something that you could choose to do, or it could happen to you accidentally if you set up an appointment with a specialist and didn't get the referral that you needed to go see that provider. So very important to remember about this point of service option and the importance of knowing whether your provider is in network or out of network. So what are we talking about when we say out of area care? During this deployment, if you have family members that might be traveling out of state or a few states over to go stay with families or to visit families, that's great. But it's really important to remember that when you're out of your prime area, your home station, you have access to urgent, walk-in care clinic, and emergency care, but you will not be able to get routine care when you're out of area. Once you're enrolled into a TRICARE Prime plan, it is expected that you're going to get all your routine care with your Prime providers in your local area. So again, if you're out of area, whether you're traveling for vacation or visiting family, if somebody gets sick, you can always go to any emergency room or urgent care facility, and that will be covered. Lastly, I just want to touch quickly on what kind of benefits you're going to have when you come back after the deployment. We mentioned it in the deployment cycle. When you do get back, you'll have 180 days of continued TRICARE benefits. You can get the premium free benefit if you do sign up for it. It is not automatic. You and your families will be put into TRICARE Select, which is not the free care. And if you do want the free care, you have to take action to make a phone call to get yourself and your family enrolled. So very important to remember that piece, that it is not automatic and you will need to enroll. For those of you that will not be going back to a commercial job with commercial health insurance, you do have the option to enroll into TRICARE Reserve Select. That is a premium-based TRICARE plan for those of our M-Day or traditional soldiers to purchase coverage. The rates on this slide are for 2020, and I know that you'll be coming back probably in 2021 or 2022. This will all be reviewed with you at the post-deployment meetings, and we'll have the actual costs for you at that time. You do have to enroll either online or via the web. And if you want continuous coverage from your TAMP, you're going to want to make sure to get yourself enrolled just before your TAMP ends. Thank you. We've listed some important numbers for you here. I'm sure that you're going to be getting some fact sheets for most all the TRICARE support contractors so that you and your families have good access to whoever you need to for your questions. I would just like to put it out there that if anybody has any questions, needs to have DEERS checked or your eligibility checked or see how you're enrolled, please don't hesitate to give me a call. I'm always available to help. My toll-free number was on the first slide, and it is listed here again, Denise Luck, 866-740-2623. I wish you all the best during the deployment, and again, please don't hesitate to give me a call or have your families give me a call if they have any questions. Thank you so much.